Good morning. My name is Michael Burnswag. Today's date is 5/21, 2025. This is my note sheet. All right. So today I'm going to be going over some different syndromes, specifically respiratory syndromes. And I'm going to be focusing specifically on acute respiratory distress syndrome. Um, so what acute respiratory distress syndrome is basically it's an acute inflammation and fluid accumulation within the alveoli of the lungs, which then creates decreased lung compliance, impaired gas exchange, which then leads to, severe refractory hypoxemia. And some clinical manifestations of this would be severe shortness of breath. Most likely, um, if you develop acute, ARDS or acute respiratory distress syndrome, ARDS for short, you're going to be requiring mechanical ventilation um, because you're just not going to be able to breathe on your own due to the impaired gas exchange and the decreased lung compliance. Another clinical manifestation, as I have said, is refractory hypoxemia. So in all these cases, despite increasing the oxygen delivery, let's say like 100% concentration of oxygen, your oxygen saturations are not going to be coming up. Despite giving 100% oxygen, let's say someone could still be sat in the 80s, 70s, depending on the severity of the ARDS. Um, Another clinical manifestation could be crackles upon lung auscultation, and another big one is diffuse ground glass opacities um, when an X-ray or a CT scan is done. So those are all, pretty big clinical manifestations that you usually see within patients that, develop ARDS. And now I'm going to be going over some different some other respiratory syndromes that are in that respiratory category, but how they differentiate from ARDS. First, going to be going over briefly going over acute bronchial syndrome. Acute bronchial syndrome involves the bronchial airways. Tends to not interfere with the alveoli, and this inflammation is usually caused by infection. You can usually see like productive cough or wheezing and fever with this, and potentially, a very slight minimal amount of hypoxia. But the main difference between acute bronchial syndrome and ARDS is that acute bronchial syndrome, it does not damage the alveoli. It tends to typically affect the bronchioles. And ARDS is much more severe and leads to much more severe hypoxemia that does not improve with oxygen therapy compared to acute bronchial syndrome, which usually does, oxygen saturations do improve with oxygen therapy um, within that syndrome. One another syndrome is emphysema syndrome, and now this is a chronic syndrome, not an acute syndrome. Usually fits under like the chronic obstructive diseases within the respiratory system. Uh, Although emphysema does affect alveoli, it is chronic in nature. So emphysema usually affects the alveolar walls, and like there's a destruction within the alveolar walls, which causes air trapping, usually caused by long-term smoking. Um, this usually presents with dyspnea on exertion or chronic hypercapnia or retaining CO2. And how this differs is, a big part. Although it does both affect the alveoli, it's that emphysema is chronic. It takes a long time to develop this syndrome. ARDS is an abrupt onset, usually caused by inflammatory mediators and things like that. Um, so that's a big difference is that, ARDS is acute, emphysema is chronic, although it does affect the alveoli. It also does affect in different ways. In ARDS, the alveoli are, typically affected by increased permeability due to inflammatory measures and fluid accumulation. And the last syndrome I'm going to be going over that also fits in that respiratory tr respiratory category, but differs from ARDS is bronchiectasis syndrome. Bronchiectasis syndrome is also a chronic syndrome, not acute. So that is usually like permanent dilation of the bronchi, often due to repeated infections or genetic diseases such as like cystic fibrosis. Um, and symptoms of this could be, chronic productive cough, reoccurrent infections, and unlike ARDS, again, this is chronic. Also does not affect the alveoli. Um, and ours is much more acute. So that's really a big difference. Ours is also again, um, it causes refractory hypoxemia and bronchiectasis syndrome. This would not cause refractory hypoxemia. Um, Next, I'm going to be going over some diseases that fit under that ARDS kind of tree, things that can trigger ARDS. So first, I'm going to be going over briefly going over these diseases and start off with sepsis. So sepsis is an infectious process that ends up involving a large majority of the body because the body is trying to fight this infection, which ends up leading to a widespread inflammatory response throughout the body. And these inflammatory mediators like cytokines um, end up circulating through the system and could land in the lungs, which then causes um, inflammation within the lungs, which then increases permeability of the alveoli, causing inflammation, increased permeability, which causes fluid shifts. So then there's now fluid accumulation in the lungs. Um, and then once that happens, it causes an impaired gas exchange. This is when you see, that refractory hypoxemia. Um, Another disease is pneumonia. Pneumonia is, an infection again within the lungs. And again, a lot of these different diseases will all, the same thing will happen. Like in pneumonia, like severe pneumonia that develops into ARDS. That the pneumonia will cause an inflammatory response, just as sepsis would, which then causes the inflammation and increased permeability within the alveoli, which causes the fluid shifts, fluid accumulation, and then impaired gas exchange, furthering leading to the impaired gas exchange and the refractory hypoxemia. Um, and the last disease that could, precipitate ARDS is, very severe acute pancreatitis. So just like the other two before, due to the pancreatitis, there is a, severe inflammatory response within the pancreas. So with the with the infectious process, the inflammatory process within the pancreas creates like a cytokine storm and also releases pancreatic enzymes, which then enters the bloodstream, which then in turn can end up inside of the lungs, these inflammatory mediators, which then again cause inflammation, increased permeability, which then leads to fluid accumulation, which leads to that low lung compliance, decreased gas exchange, um, which and then in turn leads to ours, the refractory hypoxemia. Um, yeah, and that's pretty much everything that I believe I had to cover. I hope you enjoyed my presentation, and I hope you have a good day. Thank you.